Hello. Today's session, we are going to talk about the mental well-being of our elders. Our elders have made major contributions to the society during their constructive years. There is a large amount of depression which is rampant amongst our elders. In fact, some studies have shown that about 10% of visits of our elders to doctors is for depression. However, what's very special about the depression in the elderly is, again, it presents in very atypical fashions. So it's not like an elder is going to come and tell us that, look, I cry a lot and I'm very depressed and my mood is low. It comes in very masked fashions, and it's up to the specialist and the doctor to understand, based on the various presentations, that that depression is happening to a particular elder. Now, the reason being is there's a lot of loss happening. So many of them retire, so they lose their normal routine. Many of them lose friends, they lose their spouse, they are losing function of a number of their body parts, which is very frightening. And overlying fear of the inevitable, that is death, also looms quite large in their minds. All this can make it a very easy ground for depression to set in. So that's a very interesting question. There are many reasons for this. When I interviewed this patient, I found that she was paying very close attention to my lip movements. And that's when I realized that this person was actually suffering from age-related hearing loss. And then when we evaluated her and got her the hearing aids, she then became quite functional. So here was one instance where they tend to withdraw, is because they are ashamed of asking you to repeat yourself again and again because of the hearing loss. Other people withdraw is because, they might have decreased mobility, like because of arthritis, they are not very mobile. And they consider that to be a deterrent to ask somebody to take them outdoors or to use like a mobile device, like a walker. Many of them consider that as a stigma, and they don't want to do that in public. Another reason being is for them to withdraw at large is again because of mental health issues such as depression, where they generally withdraw from most activities. So these are some of the many reasons why we find that some elders will start withdrawing from their usual activities. So the reason I think most commonly is the stigma attached to mental health issues. So they don't want to be perceived as crazy, where their kids kind of reject them. That's one of the issues. Second, they believe that they just should not, go out and ask for help all the time. All of these are not really true. And part of it is just encouraging the elders that none of this should be a deterrent to seek help, counseling. So there's no reason why we should not offer it to them and be proactive about it. And that's why I encourage the care with a geriatric specialist or with one of their specialized doctors whom they establish a rapport with whom they can come out and express what exactly their fears are. A fear of dying, fear of the losing. All of this, if it's brought out in a very non-confrontational way, it plays a very important role so that they feel comfortable asking for help. So that's a very important concern and a very important question. Part of the problem, memory loss does occur to smaller and greater extents. Minor extents don't interfere with their lifestyle. Major extents do interfere with lifestyle. हमारे जो बड़े हैं, उनको यह भय हमेशा रहता है कि हमारी याददाश्त कम न हो जाए उम्र के हिसाब से. Now, there are several mental exercises that an elder can adopt to help slow down the natural aging of the memory process. So what I encourage, at the age of 60s, even 70s, is to pick up a new skill. So whether it might be learning a new digital device, or trying to learn a new language, or perhaps even picking up a small instrument, musical instrument, and learning to use that, or pick up some puzzles, which are comfortable in your language to be done. Anything that keeps those mental circuits constantly engaged will play a big role in slowing down the aging of the memory. Social interaction, जैसे लोगों से बात करना, लोगों से आइदर फिजिकली मिलना या वर्चुअली डिजिटली मिलना, वो कंटिन्यू रखिए. या तो कार्ड्स खेलना, ब्रिज खेलना, चेस खेलना, इन सब चीज़ों से आप अपनी मेमोरी या याददाश्त को और ज़्यादा एक तरह का टॉनिक या बूस्ट दे सकते हैं. आई एम ग्लैड यू बीन विद अस फॉर दिस वेरी इंपॉर्टेंट टॉपिक, which is mental health and mental well-being of our elders. We will meet again with another session talking about physical well-being of our seniors. Thank you.